A new UCT and Medical Research Council study has found alcohol bans lead to a drop in unnatural deaths. According to the findings, a 4 to 7 hour restriction sees a drop of 42 deaths per day, while a total ban leads to 74 lives saved per day. Let's discuss this with the Medical Research Council's Charles Parry, who joins me now for that conversation. Mr. Parry, thank you so much for your time. Take us through, through your findings. What does the data show us in what you've said as the MRC has been a natural experiment that the lockdowns over the past year and a half have afforded us?
Thank you. The aim of the study was to evaluate the impact of restrictions on the sale of alcohol and also the duration of the curfew on excess unnatural deaths in South Africa. So what we have is many years of data of showing the profile, a weekly profile of unnatural deaths. That's deaths from stabbings, falls, suicides, other violence, and so on. And we can predict what it should be at given weeks of the year. So we looked at the difference between the observed and the expected level. And sometimes it was higher and sometimes it was lower. So we were particularly looking at the effect of the bans, full bans and partial bans, and also the curfews. So the full restrictions on alcohol obviously had a significant reduction on unnatural deaths and increasing with the duration of curfew. The hard lockdown, as you said, brought down unnatural deaths by 49%. And when the sale of alcohol was banned completely, together with curfews of between 4 and 7 hours, it reduced unnatural deaths by 26%, or roughly 42, as you said. But when there were partial or no restrictions on the sale of alcohol, there was no reduction in unnatural deaths, except slightly for the 6 weeks following the end of the level 5 lockdown, when there was a 13% drop, but it wasn't statistically significant. So basically what we found was that complete restrictions on the sale of alcohol do avert unnatural deaths and prevent overload on the healthcare system. And unnatural deaths are an extreme form of trauma. But obviously, this is not a long-term policy. We can't have complete bans on alcohol. But what it does show is that we can disrupt the harm that we get from alcohol, but we should look for more effective ways that won't have such an effect on livelihoods and so on.
From what we know about alcohol consumption in South Africa led you to the conclusions that you make? Just draw the picture for us then that talks about what we know about alcohol consumption in South Africa, and in particular the harm from excessive drinking that you have observed over the years that leads you to conclude that the reduction in the number of unnatural excess deaths that you observed over those periods of time must be related to our culture of drinking.
We are the 6th highest country in the world in terms of the amount of absolute alcohol consumed per drinker per day at roughly 64 grams, which is about 5 drinks per drinker per day. So while many people don't drink, many people who do drink, and I consume alcohol, but many people who do drink excessively. So about 6 out of 10 will engage in heavy drinking. And it has a number of different negative outcomes. We know it's related to HIV, TB, non-communicable diseases, heart disease, strokes, and liver damage, and so on. But what we've been studying here is the effect on trauma, and we have very high levels of alcohol-related trauma in South Africa, resulting in injury and death. And so we know that, in fact, I've been speaking to trauma doctors this weekend. With the ban on alcohol sales we're experiencing now, we are experiencing a drop in trauma cases at this time, which is freeing up cases. But we do need to look at other more workable solutions, for example, pricing, constraints on advertising, and so on, that will allow people to drink, but reduce the burden that the country is experiencing, and which has become very apparent during this time of COVID-19.
All right, Professor Charles Parry, thank you so much for your insights there. The study that was done by the MRC and the University of Cape Town, using what they are calling the natural experiment that the bans that we've had on alcohol have afforded us during this time of the lockdown and COVID-19. This is All Angles on